You've been lied to your entire life. They told you masturbation was something shameful, that by the time you hit 60, you were supposed to stop, to quietly fade into a dignified version of aging one that ignores your body, your needs, and your health. But what if I told you that stopping isn't harmless, that it could silently sabotage your prostate, your hormones, your confidence, even your mind? My name is Dr. Edward Blake. I'm a board-certified urologist and men's health specialist with over 30 years of experience helping men just like you. And I'm here to tell you the truth, no one else will. After 60, masturbation isn't dirty, it's medicine. Done wrong, it can wreck your sensitivity, disrupt your nervous system, and crush your testosterone. But done right, it can restore function, prevent prostate disease, and keep you mentally and emotionally sharp. So, before you scroll past or laugh this off, ask yourself, what if the one thing you've been told to ignore is the very thing that could save your life? Stay with me because the next 5 minutes might change everything. Let me tell you something I wish more men had the courage to talk about. I'm Dr. Edward Blake, a urologist and men's health expert who's spent 3 decades listening to the quiet confessions of good men. Men who've worked hard, loved deeply, aged with pride, and still feel something's not right. They come into my office with shame in their eyes. Not because of what they've done wrong, but because of what they've never been told. And one of the most common truths I hear sounds like this: "Doctor, I still masturbate, but I don't feel anything anymore." Or worse, "I can only finish if I do it a certain way or watch certain things." They think it's normal, harmless, just age catching up. But it's not. It's conditioning. Every time you rush through the act, tense, distracted, numb, your nervous system learns. Your brain begins to hardwire pleasure into a very narrow set of triggers, the same position, the same motion, the same kind of stimulation. And anything outside that a real partner, a tender moment, even your own hand without a screen, starts to feel wrong. You feel less. You need more. You become disconnected from your own body. This is what I call mindless masturbation, and it's silently damaging millions of men. Now let's be clear, masturbation itself isn't the problem. It's how we do it. If you're just going through the motions, scrolling through intense images, rushing to release, checking out, emotionally, you're not feeding your body. You're numbing it. You're teaching your brain to associate arousal with artificial stimulation and disconnection. You're teaching your nervous system that pleasure only comes from intensity, not from intimacy. And over time, you lose sensitivity. Your erection quality fades. Your climax weakens or disappears altogether. Some men develop full-blown porn-induced erectile dysfunction. Others end up with delayed ejaculation or complete anorgasmia, the inability to climax at all. And worst of all, most don't even realize it's something they've trained themselves into. But the cost isn't just physical, it's emotional. You begin to feel broken, not because you are, but because your body's been rewired by repetition. You start avoiding intimacy. You stop reaching for touch. You lose connection, not just with others, but with yourself. This is how mindless habits become emotional isolation. You carry shame. You feel like something's wrong. And slowly, your confidence begins to erode. I've watched men slip into depression, lose interest in life, even show early signs of cognitive decline, all because they stopped feeling connected to their own body. And the cruelest part? It's completely preventable. Your body isn't broken. It's just overtrained in the wrong direction. And like any training, it can be reversed. The key is to slow down. To relearn touch not as a performance, but as a practice of connection. To stop treating masturbation like a guilty secret and start treating it like a form of care. Because when you touch yourself with awareness, intention, and presence, you send a message to your brain. This body still matters. I still deserve to feel alive. You don't need to stop. You need to relearn. So if something in this resonates, don't ignore it. This could be your wake-up call. Because mindless masturbation doesn't just steal your pleasure. It steals your vitality, And it's time you took it back. Let me ask you something. Most doctors never will. When was the last time you ejaculated? If that question made you uncomfortable, you're not alone. I've asked it to hundreds of older men, and most of them blink, pause, and then whisper, I don't really do that anymore. And they say it like it's expected, like it's the right thing to do after a certain age. No partner, no need, right, wrong. I'm Dr. Edward Blake, urologist and men's health specialist. And I'm here to tell you something you've probably never heard. Quitting masturbation completely, especially after 60, can be just as dangerous as doing it wrong. Let that sink in. You've been told that stopping is a sign of maturity, discipline, or dignity. But biologically, it's a recipe for decline. Here's why your prostate never stops working. It doesn't retire when your libido dips. It keeps producing fluid whether you use it or not. And when you stop ejaculating, that fluid builds up. It becomes stagnant. And that congestion leads to swelling, inflammation, and in many cases pain. I had a patient, 68, retired, widowed, dignified man. Let's call him Robert. He came to me complaining of pelvic pressure, nighttime urination, dull aching he thought was just old age. What he didn't expect me to ask was, when was the last time you ejaculated? His answer, not since my wife passed. I figured that part of life was over. But that's exactly the problem. Because when ejaculation stops, your prostate becomes a reservoir with no release valve. It backs up, it gets irritated, and over time, that chronic inflammation can increase your risk of something far worse, prostate cancer. I'm not trying to scare you, I'm showing you what no one ever taught you. A major Harvard study followed nearly 30,000 men and found that those who ejaculated at least 21 times per month had a significantly lower risk of prostate cancer compared to those who didn't. Not because ejaculation is magic, but because it's a natural detox, a reset, a maintenance system your body was designed for. And here's what's even more shocking. When my patient Robert began masturbating again, not out of lust, but out of self-care, his symptoms improved. The pressure eased, he slept better, and more importantly, something inside him came back to life. It wasn't about sex, it was about connection. Connection to his body, to his vitality, to his right to feel good, even in older age. You see, not masturbating doesn't just affect your prostate, it affects your mood, your circulation, your hormones, and your sense of self. It creates silence in the body, in the bedroom, and sometimes in your identity. And that silence, it can be the beginning of emotional isolation, the kind that leads to depression, memory decline, even early mortality. Because touch, even self-touch, is not a luxury, it's a biological need. So if you've stopped, not because you wanted to, but because you thought you should, I'm here to tell you, you don't have to disappear. Reclaim this part of yourself. Not out of shame, not out of habit, but out of respect for the body that's carried you this far. You wouldn't ignore your heart. Don't ignore your prostate. You're not too old to feel. You're not too old to heal. And you are never too old to reconnect. Let me say something radical. Shame is not just a feeling. It's a toxin. It lives in your blood pressure, in your sleep, in your chest when you avoid the mirror. And for millions of older men, it starts with how they feel about masturbation. I'm Dr. Edward Blake. I've spent over 3 decades listening to men in their 60s, 70s, even 80s, smart, strong, successful men, sit down in my office and quietly confess something they've never told anyone else. Not because it's taboo, but because they've been taught to be ashamed. When I ask, do you ever touch yourself? They don't laugh. They don't get offended. They go quiet. They shift in their seats, look down, say things like, that's not for me anymore. Or worse, I thought that was just for younger guys. Where did that idea come from? Because here's the truth. Shame around self-touch is not natural. It's inherited. It comes from how we were raised. From churches, locker rooms, fathers who never talked about it or talked about it like it was dirty. And it stays with you. Even now, decades later, that shame lingers in your nervous system. It shapes how you breathe, how you sleep, how you connect, or don't connect with your own body. But it gets worse. Shame isn't just emotional, it's physical. It increases cortisol, your stress hormone. It lowers testosterone. It blocks oxytocin, the hormone that makes you feel bonded, calm, connected. I've seen men who haven't been touched by anyone, including themselves, in over 10 years. They're not just lonely, they're tired, foggy, disconnected from their bodies and from life. And here's the kicker. They didn't stop touching themselves because they didn't want to. They stopped because they thought they weren't supposed to. Let that sink in. They gave up a basic act of connection because society told them it was no longer appropriate. That message is killing us. Not quickly, not dramatically, but quietly. One night of poor sleep, 1 week without energy, 1 year without intimacy, until finally they stop reaching for anything physically or emotionally. That's not just aging. That's emotional suppression turning into physical decline. I had a patient, 74, widower, former teacher. He told me, "I haven't felt like myself in years. I don't know why. I just feel faded." So we started small. No medications, no big changes. Just 10 minutes a day of self-touch. Not for pleasure, for presence. Within weeks, he was sleeping better. His blood pressure came down. He started walking differently. His voice had weight again. He smiled. That's what shame steals your spark. And when you reclaim your body, even in small ways, you start to reclaim your life. Because here's the truth. No one told you. You are never too old to feel alive. Never too old to touch yourself with care. Never too old to rewrite the story that says desire, emotion, and intimacy aren't for men your age. So if you've been carrying that shame silently for years, this is your invitation to let it go. You are not broken. You were never wrong for wanting to feel. And your body is still yours. Touch it. Honor it. Reconnect with it. Because healing doesn't begin in your prostate. It begins in your heart. Feeling sluggish. This might be why your fire is fading. Let me ask you something no one ever dares to say out loud. When was the last time you felt like you? Not just alive, but masculine, charged, clear. Like your body was working with you, not against you. If it's been a while, you're not alone. But what if I told you the reason why might not be aging at all? I'm Dr. Edward Blake, urologist and men's health specialist. And I'm here to tell you something most doctors won't. Your testosterone doesn't just fade with age. It fades with disconnection. You see, your body isn't a machine that slowly breaks down. It's a living system that responds to how you live. When you stop engaging with your sexual self, physically, emotionally, hormonally, your body takes that as a signal. It says, he doesn't need this anymore. And it starts powering things down. Testosterone levels drop. Energy fades, muscle mass shrinks, belly fat creeps in, mood tanks, motivation disappears. And worst of all, you barely notice it until it's already happened. This isn't just theory, it's biology. Your testosterone is a responsive hormone. That means it reacts to what you feed it. Touch, desire, engagement, intimacy, even solo moments of arousal. When those go missing, your brain tells your endocrine system, let's conserve energy. Let's shut this part down. And the shutdown isn't just physical, it's psychological. You stop initiating things, you stop wanting things, you stop seeing yourself as a vital masculine man. Not because you're old, but because your hormones are taking cues from your lack of connection. I had a patient named Mike, retired cop, 72 years old. Sharp mind, solid build, but always tired. He told me, I don't feel like myself anymore. We ran his labs, his testosterone barely hanging on. Not because he had a disease, but because he hadn't touched himself or anyone else in years. I asked him a simple question. When was the last time you felt any sexual energy at all? He looked at me and said, I think I turned it off after my wife passed. I didn't think it mattered anymore. But it did matter. And not for sex, for life. Because here's the truth. Testosterone fuels more than your libido. It impacts your heart, health, bone, density, brain function, confidence, sleep, even how you carry yourself. And when it's gone, it's like the color drains out of everything. But here's the good news, and it's big. Your body can bounce back. When Mike started re-engaging, not with a partner, but with himself, things changed. Slowly, quietly, but clearly. He began a daily ritual of conscious self-touch. No porn, no pressure, just presence. Within 6 weeks, his energy improved. His eyes lit up. His posture straightened. His testosterone levels up 28%. That's not magic. That's what happens when you stop telling your body "I'm done" and start whispering "I still want to feel." Your brain listens. Your hormones respond. Because sexual engagement isn't just about pleasure. It's about preserving your identity. So if you've been walking around thinking your best days are behind you, think again. Your biology is waiting for a signal. And that signal can be as simple as 10 minutes a day of reclaiming your touch, your breath, your body. Not for lust, for life. This isn't about fixing what's broken. It's about reminding yourself that nothing was broken to begin with. There's a lie so many men carry into their later years. And it sounds like this: I'm not having sex anymore, so erections don't matter. If you've ever said that, or even thought it quietly, I need you to hear me. That belief could be costing you more than your sex life. It could be slowly eroding your health, your confidence, and even your brain function. I'm Dr. Edward Blake, urologist and men's health educator. And after decades of treating older men, I can tell you, without hesitation, erectile function is not just about sex. It's a sign of vascular health, nerve integrity, hormone balance, and overall vitality. Here's the hard truth. No one says out loud, if you stop having erections regularly, you risk losing the ability altogether. Not because you're aging, but because you're not using it. Let me explain. Erections aren't mechanical. They're biological. They rely on healthy blood flow, relaxed, smooth muscle, nitric oxide signaling, and well-tuned nerves. When you stop having erections, whether from lack of intimacy, shame, depression, or simply thinking you're past that stage, your body assumes the system is no longer needed. And like any other system in the body that goes unused, it begins to shut down. The tissues lose elasticity. Blood vessels stiffen. Oxygen flow decreases. Scar tissue, what we call fibrosis, can begin to form. And slowly, quietly, your erection fades. Even if the desire is still there. Even if the mind wants it. The body simply doesn't respond the way it used to. It's not dysfunction, it's disuse. I had a patient once, Harold, 69, retired Marine. Strong, disciplined, but he'd gone 6 years without an erection. Not because he couldn't, but because he thought it didn't matter anymore. I'm done with all that he said. Until the day he met someone new, and his body didn't cooperate. The frustration, the shame, the confusion. He felt broken, but he wasn't. He was simply out of practice. You don't lose your ability to have erections because you age. You lose it because your body hasn't been reminded that it still matters. Here's what most men don't know. You can exercise your erectile system, just like you stretch to stay flexible, or lift weights to keep your muscles strong. You can and should maintain erections regularly, even if there's no partner involved. Self-stimulation, sensual imagination, even non-sexual arousal, like touch intimacy or fantasy. They all tell your body, hey, we still need this. And your body responds. Nitric oxide production ramps up, blood vessels stay pliable, neural pathways stay active, and your confidence. It starts to return, because this isn't just about your penis, it's about your presence. A man who feels connected to his sexual energy walks differently. He speaks with more assurance. He carries his body with power. The tragedy is too many men think they've aged out of that right. They haven't. The erectile system is use it or lose it. And the good news is, you can start using it again. Without pressure, without shame. Not to chase pleasure, but to preserve vitality. Just 10 minutes a day of conscious self-touch. Breathwork, awareness, no porn, no rush, no goal, but connection. You're not broken, you're simply quiet, and the silence has gone on long enough. If your body hasn't felt alive in a while, this is your wake-up call, because the most dangerous thing you can do is nothing. Your biology doesn't stop working with age. It stops working when you stop showing up. So today, decide to show up. Your body is still listening, and it still wants to live. Let's talk about something most older men never admit, but nearly all of them experience: porn. Even saying the word might make you shift in your chair. Maybe you're tempted to scroll past, pretend it doesn't apply to you. But if you're a man over 60 who still occasionally watches adult content, or used to, you need to hear this. Because what I'm about to tell you might explain why your body doesn't respond like it used to, why arousal feels distant, and why intimacy, real intimacy, feels harder than ever. I'm Dr. Edward Blake, a men's health urologist. And I've sat across from hundreds of men, strong, smart, capable, who felt ashamed, confused, or broken about their sexual performance. And you know what many of them had in common? They were quietly depending on porn. Not obsessively, not constantly, but just enough to rewire their brains in ways they never saw coming. See, the porn of today isn't what you grew up with. Back then, it was a magazine under the mattress. Now, it's an endless stream of ultra-stimulating, high-definition, fast-switching content, available 24/7 instantly. And your brain, especially an aging brain, isn't built for that. Here's the science. Every time you watch porn, especially fast-paced novel scenes, your brain releases dopamine, the chemical of motivation, reward, and pleasure. But just like sugar alcohol, or any overstimulating input, too much dopamine too often leads to desensitization. That means the things that used to turn you on, simple touch, emotional connection, even a real partner, no longer work. You start to crave more intensity, more novelty, just to feel something. And that's not a matter of preference. That's neurochemical conditioning. The more you rely on artificial stimulation, the more your brain's baseline shifts. And over time, your body follows. I've seen it again and again. Men who can only get aroused with a screen. Men who lose interest in real-life partners. Men who feel numb during intimacy and don't know why. It's not age, it's wiring. And the worst part, most of them never connect the dots. They blame themselves. They think they're just past their prime. But what's really happening is that their brain has been trained to expect stimulation that real life can't match. This is what we call porn-induced erectile dysfunction, PIED. It's real, it's rising, and it's completely preventable. The good news: your brain is plastic even in your 60s, 70s, or 80s, which means you can rewire it. But it starts by stepping away from the artificial highs and returning to real grounded connection with your own body. That doesn't mean giving up pleasure. It means reclaiming it. Through slower, intentional self-touch. Through fantasy that emerges from your own mind, not from someone else's production. Through presence, breath, and awareness, not rush, shame, or habit. Some men take a 30-day break from all visual stimulation. Others ease off gradually. What matters is that you make the shift from consumption to connection. Because when you stop flooding your brain with digital overload, something amazing happens. Sensitivity returns, arousal deepens, erections improve, and most importantly, you start to feel like you again. I had a patient, Don, 72, divorced, lonely, and addicted to scrolling late at night. He said, "Doc, I can't feel anything unless I'm watching something intense." We worked together slowly. He cut the habit. He practiced mindful touch, and within weeks, he told me, "For the first time in years, I feel alive." That's not magic. That's biology returning to balance. So if porn has dulled your senses, numbed your desire, or made real intimacy feel distant, know this: you're not broken. You're retrainable, and it's never too late to feel again. Your brain is still listening. And the moment you choose real over artificial, you begin the process of getting your life and your body back. It's not your blood pressure, not your cholesterol, not your testosterone. The biggest health risk facing men over 60: isolation. Not just being alone, but going untouched. Physically, emotionally, spiritually. And the damage it does, it's silent, it's slow, and it's deadly. I'm Dr. Edward Blake, a urologist and men's health expert with over 30 years of experience. And I need to tell you something most doctors won't. When you stop being touched, when you stop touching yourself, when you stop connecting to your own body, your nervous system starts to shut down. Not in some metaphorical way, in real, measurable, biological ways. Let me tell you about a patient, Peter, 76, retired Navy, strong handshake, polite. But when I asked him, when was the last time someone touched you? He looked at me like I'd spoken a different language. A hug, a hand on the shoulder, anything I asked. He thought for a moment. Maybe a year ago, he said. 1 year. No touch, no physical human contact. And he didn't say it with sadness. He said it with resignation, like it was just part of growing old. But here's what Peter and millions of men like him don't realize: touch is not a luxury. It's not just intimacy or affection. It's a biological necessity. When your skin goes untouched for long enough, your brain begins to turn the volume down. Oxytocin levels drop. Cortisol rises. Your immune system weakens. Your sleep gets worse. Your blood pressure climbs. Your risk for depression, dementia, even early death goes up. Why? Because the body assumes it's no longer needed, that you've entered a stage of decline. So it starts to shut down. That's the truth most men never hear. And it starts with something as simple and tragic as not touching yourself anymore. Not because of lust, not because of shame, but because you've slowly started to believe the lie that this part of your life is over. And when you stop engaging with your body, your brain believes you're fading. Let me be clear, this is not about sex. This is about vitality. It's about presence. And most importantly, it's about connection. You wouldn't ignore your heart. You wouldn't ignore your lungs. Why would you ignore your skin, your body's largest organ, the gateway to your nervous system? This isn't theory. Studies show that elderly individuals who go extended periods without physical contact are more likely to experience depression, memory loss, and weakened immune function. And here's the kicker. It's preventable. I've seen men come back to life, not from medication, not from surgery, but from something far simpler: permission. Permission to touch themselves, to reconnect, to feel. When they do, their posture changes, their voice deepens, their eyes light up again. They begin to feel like men again. Not old, not invisible, just alive. Peter. He started with a simple daily ritual. 10 minutes, no goal, just breathing. Presence. Gentle, conscious self-touch. Within weeks, his blood pressure lowered. His mood lifted. He smiled more. And one day, he looked at me and said, "Doc, I thought I was done. Turns out I was just quiet." So if you've been feeling like something's missing, like you're drifting from your own body, like your spirit is dimming, it's not too late. You don't need a partner. You don't need anyone's permission. You just need one thing: to start touching yourself, not for pleasure, but for presence. Because the most dangerous mistake older men make isn't giving up sex. It's giving up on themselves. And you, my friend, still have more life to feel. Let me ask you something personal. When was the last time you touched your own body, not out of habit, not out of desperation, but with real awareness? When was the last time you gave yourself permission to feel alive? If you've made it this far, if something in this message has stirred something in you, then what I'm about to share may be the most important part of all. Because information isn't enough. What you need now is a way to begin again. That's why I created what I call the Golden Protocol. It's not a pill, it's not a gadget, it's a practice, a daily ritual. One I give to my own patients, men in their 60s, 70s, even 80s, who feel like their bodies have gone quiet, their spark has faded, their vitality is slipping away. And here's the truth most men never hear. You can't fix what you don't feel. But the moment you reconnect even gently, even briefly, your body starts to listen again. So what is the golden protocol? It's simple. 10 minutes a day. That's it. A quiet space. No distractions. No porn. No performance. Just you, your breath, and your body. You begin by placing your hands on your chest. Feel your heartbeat. Close your eyes. Breathe deeply. Then slowly, you explore your arms, your abdomen, your thighs, your groin. You touch yourself, not to arouse, but to reconnect. You listen to sensation. You observe tension. You breathe through the discomfort. And if in those moments desire arises, let it. But don't chase it. This isn't about climax. It's about reclamation. The goal of the golden protocol is nervous system activation, not sexual gratification. Why does that matter? Because regular mindful touch has been shown to lower cortisol, your body's stress hormone, increase oxytocin, the trust and bonding chemical, stimulate blood flow and nitric oxide, release key to vascular health, rebuild neural pathways that enhance sensitivity and arousal, improve sleep mood and emotional resilience, and most importantly, it begins to undo the conditioning of shame, silence, and isolation that so many older men carry. One man I worked with, Jim, 68, was convinced his body had stopped responding. He hadn't felt anything in years. But after 3 weeks of practicing the golden protocol, he told me, "Doc, I don't even care about sex anymore. I just feel like I'm back inside my skin again." That's the power of presence. This practice isn't about becoming who you were. It's about becoming who you still are beneath the noise, beneath the guilt, beneath the outdated belief that aging means disappearing. You are not invisible. You are not broken. You are still here. And every time you show up to this practice, even for just 10 minutes, you're telling your body, "I haven't given up on you." So here's my challenge to you. Tonight before bed, find a quiet space. Turn off the lights. Put away the phone and begin. No judgment, no expectations. Just touch. Just breath. Just you. Because the road back to vitality doesn't start in a doctor's office. It starts with your own 2 hands. This is your body. This is your time. This is your return. And it starts today with the golden protocol. Let's make something clear. This conversation was never just about sex. It's about your connection to life itself. See, when we talk about masturbation, erections, touch, and testosterone, we're not just talking about biology. We're talking about your identity, your energy, your will to engage with the world. We're talking about whether you wake up feeling like a man who's alive or one who's slowly disappearing. Because what I've learned after decades of working with older men is this: most men don't fear death. They fear irrelevance. They fear becoming invisible. They fear waking up one day and not recognizing the man in the mirror. And that fear, it starts not in your heart, not in your mind, but in your body. In the places you've stopped visiting, the urges you've ignored, the routines you've abandoned, the sensations you've silenced. I've seen men who were leaders, builders, fathers, men who once radiated strength, slowly give up the very things that made them feel whole. And not because they wanted to, but because the world told them it was time to move on. Move on from sex. Move on from pleasure. Move on from desire. But here's what no one says. When you disconnect from desire, you don't just lose arousal. You lose motivation. You lose drive. You lose life. Because sexual energy is life force energy. It's tied to your creativity, your confidence, your purpose. When that energy is suppressed, everything else begins to dull. Your workouts fade, your voice softens, your eyes dim, your step slows, and little by little the world begins to feel heavier. But it doesn't have to be that way, because what you're reclaiming when you reconnect with your body, it's not just pleasure, it's presence. It's the ability to walk into a room and feel grounded in your skin. It's the fire in your belly that says, "I'm still here and I still matter." Let me tell you about a man named Charles, 71, retired judge. sharp mind, steady hands, but he came to me feeling completely flat. "Doc," he said, "it's like my spark's gone. I don't laugh. I don't cry. I'm just here." He hadn't touched himself in over 5 years. Not because he couldn't, but because he thought he shouldn't. Thought it was behind him. Something for younger men. But over time, I helped Charles see what he was really missing wasn't sex, it was connection. To himself, to sensation, to aliveness. With gentle practice, he began to feel again. Not lust, not fantasy, vitality. His words, "It's like color returned to my life." That's what this is about. Because when you reclaim this part of yourself, you're not chasing youth, you're reclaiming agency. You're telling the world, "I'm not done yet." You're not passive. You're not fading. You're engaged, curious, alive. And the science backs this up. Men who stay sexually engaged solo or partnered experience lower rates of depression, stronger immune function, healthier testosterone levels, greater cardiovascular health, longer lifespans. But more than that, they feel like themselves again. So no, this isn't about fantasy or lust. It's about reclaiming your relationship with life. The way you touch yourself matters not because of what it leads to, but because of what it reminds you. You are not a machine. You are not an afterthought. You are not too old to feel. You are still here. And every breath you take is permission to start again. This is about showing up in your own life, not as a shadow, but as a man who still wants to feel everything this world has to offer. So don't shrink. Don't retreat. Reclaim. Not just your sex life, your whole damn life. One of the most powerful lessons from this message is simple yet profound. You are never too old to reconnect with yourself. In a society that often tells older men to slow down, go quiet, or suppress desire, it's easy to lose touch, not just with your body, but with your identity. But your need for touch, connection, and vitality doesn't disappear with age. In fact, honoring these needs is what keeps you grounded, present, and alive. Neglect, whether physical, emotional, or hormonal, leads to slow, silent decline. But awareness and gentle, intentional self-care can reverse that drift. Whether it's allowing yourself to feel pleasure again, confronting old shame, or simply taking 10 minutes each day to tune into your body, your health, confidence, and energy are still within reach. This isn't about sex, it's about staying connected to your own life. Because when you stop believing that part of you matters, other parts start fading too. But when you remember you're still here, you still matter. Your whole world can shift. If this message resonated with you, don't just scroll past. Leave a comment below and let us know how this spoke to you. Are you ready to reclaim your health and vitality? Save this video to revisit when you need a reminder, and don't forget to subscribe for more honest, science-backed insights tailored for men like you. Your feedback helps us reach more people who need to hear this. Hit the like button, ring the notification bell, and let's build a community where aging doesn't mean fading, it means fighting smarter. You're not alone. Let's do this together.